Good evening, everybody. My name is Guy Amini, President of Dentalcorp, and I want to thank you all for joining us. I do hope you are all safe and, should I say, sane as we continue to navigate this very different world we find ourselves in. I'm joined tonight by someone who you're all probably very familiar with, Julian Perez, who is the Vice President of Risk Management and Compliance at Dentalcorp. And our goal tonight is a couple of things. One, to make sure that you have an opportunity to ask questions of a couple of individuals who've got a very unique vantage point on the dentistry landscape in Canada and how it's been managing the COVID-19 crisis. And as we look towards opening practices in a new environment, what that looks like. And we're hoping that it can be a little bit more interactive than probably what you're used to. So we're all eager to look at your questions and answer them as best we can. The second thing is to try to add some levity to an environment where a lot of individuals across the industry, coast to coast, are stressed. They are overwhelmed by the prospect of opening. They are overwhelmed by the prospect of navigating the regulatory landscape as it relates to reopening and delivering the services that they're so used to servicing. And we're hoping that we could provide you with some tips, some insights, and hopefully some few anecdotes where you can realize that you're not alone in this challenge, and that as an organization that we're here for you. And so I'm very pleased to be able to join you guys, and very pleased to be able to be here with Julian. And I'm not sure if you, Julian, if you realized, but when we started having these webinars when this crisis hit, what we were really trying to do was, one, acknowledge that this was a crisis that the industry has never faced. It's a crisis, frankly, that we across the globe have never encountered. And very quickly, overnight, back in March, dentistry became very isolated, and it became very complicated and stressful. And what we sought to do as an organization was to try to connect with industry, try to connect with practitioners, healthcare providers, and those inextricably tied to dentistry, to share with them some insights from key thought leaders, experts in their fields as it related to infectious disease, to compliance, to the economy, and all of its impact on how we approach dentistry. And through our webinar series, and in particular through Julian hosting so many of them, I'm not sure, Julian, if you even realize that when you crunch the numbers in terms of viewers, whether you're talking about live attendees or those who've looked at our YouTube streams, you have touched over 30% of the industry in Canada, and which is an incredible statistic. There's a lot of individuals who've been able to tune in and hear from those with a particular vantage on various areas that are impactful to dentists and staff and practitioners and patients. And I thought it would be helpful if we could hear from you, frankly, because of the unique perspective that you have on the industry, the unique perspective that you have on practice operations. And one of the things that I realized as I watched and tuned into all those webinars, that other than introducing your name and your title, people didn't really have an idea of who you were or what you did for Dentalcorp and its practices across the country. And so I thought I'd introduce you and let you speak a little bit about what you do for our practices, our dentists, our staff, and then we can go into just some things that are top of mind to those who are facing the prospect or dealing with reopening, some things that are top of mind for those navigating, again, the regulatory landscape as it stands today. And again, just some interesting anecdotes for people to realize that they're not alone. Whether or not you're part of our network, we're all dealing with this crisis. We're all navigating the difficult landscape it presents. And what we need to realize first and foremost is that we're in this together, and that whether as our network or beyond as an industry, there are things we can do to coalesce around that to help us all elevate it at the same time. So I thought I would introduce Julian and let him speak a little bit about what he does at Dentalcorp, what his team does as it relates to our practices and our dentists and their staff. And then we'll go into some questions that we know are top of mind. as well as open it up for questions from you guys, whether or not you've had a chance to read about them or a chance to speak to someone. Between Julian and myself, hopefully you find some sort of resource or perspective that is helpful as you navigate your own personal journeys. And so without further ado, thank you, Julian, for being a part of this. For those who don't know, Julian Perez is our Vice President of Risk Management and Compliance at dentalcorp. And I'll give you a bit of a funny story. So as an organization, despite the fact that we're just over 8 years old, we've always realized the importance of setting the gold standard in how we operate our practice and making sure that whether it was our dentists or our staff, that they knew what they needed to do to deliver a great experience, that they knew what they needed to do to deliver a safe experience for everyone. And we knew that we needed to build a team that had expertise in that regard. And back in 2015, I remember as we were trying to build that team, we approached Julian, who at the time had just left the Royal College of Dental Surgeons of Ontario to join PLP, which was the liability insurer and malpractice insurer for dentists in Ontario. And I tried to convince him to join dentalcorp at the time. And while I was not clearly charming enough, he did say no. But he said no because the individual that he worked with at PLP, he had said at the time, was a brilliant individual and someone he wanted to learn from and grow from. And I didn't take that personally at the time. But eventually Julian found his way to dentalcorp, and we've had a tremendous ride since. He's added tremendous value to our business, and has been a tremendous resource for our practices. On a good day, his team fields hundreds of requests from our practices around how to navigate doing what they need to do to comply with the regulatory authorities, and more so doing what they need to do to deliver a great, safe experience to patients. And we couldn't be happier to have Julian and his team as part of our organization. And I want to give him an opportunity to speak to the industry at large about what they do at dentalcorp and why it seems so valuable from our partners and our practitioners and our staff alike. Julian?
And starting again, I think I was muted there, but I just wanted to thank you for that really generous introduction and say that I'm really honored that you invited me on as a co-host or guest to this webinar series. I have an amazing team. So I am the head of the compliance and risk functions here at dentalcorp. And my team consists of a bunch of all-stars as far as I'm concerned. I have 2 dentists on my team, both of whom have extensive experience in doing practice audits when it comes to billing and record keeping. I have 2 hygienists, so those dentists are Dr. Michelle Budd and Dr. Christiane Blais, 2 registered dental hygienists on my team, Elaine Powell and Jamie Robertson, who are both experts in infection prevention and control. They have, a combined 50 years, 60 years plus of working in the dental industry, dental community, and just understand the profession so well. So, I honestly couldn't do anything without my team. And I have an amazing analyst, Jeffrey Lee, and a coordinator who keeps us all together and makes sure that we're doing the job we're supposed to be doing, Tasia Corabrook. So I have a fantastic team. So I just want to give a big shout out to them and let them know how much I appreciate them, and that I recognize that we wouldn't be able to service and support our dental clinics without them. So thank you very much, all of you. What we do is, well, it depends on the day, quite frankly. It depends on our practices and our clinics and the support that they need. And it is extremely diverse. But, I'm a lawyer, so I deal with some of the legal issues that people will have. There may be complaints. There may be a malpractice lawsuit. I make sure that those are being handled appropriately, and that our dentists or hygienists or dental assistants or whomever might be involved is well advised, that they benefit from the experience of myself and my team. So, there's that legal element that comes up from time to time. And then, there are the sort of peer-reviewed aspects, like chart reviews, and we do chart audits regularly, basically to make sure that people don't have a problem in the future. That it's meant to be proactive, although sometimes it is responsive, to a complaint or something like that, or a patient issue. But we review charts, we give people feedback, we make sure that people are taking notes so that the treatment that they provide is well justified, and that all of their documentation is supporting the important work that they do to improve the oral health of their patients. We also make sure that we're ahead of the curve when it comes to billing third parties, so that we never have to deal with insurance audits or anything like that. Or if we get the occasional spot audit, that is not a problem. So that's a big aspect, and that's why a number of the people on my team have experience previously either working for a in-house third-party insurance audit team, or a organization that is specifically dedicated to doing audits. In addition to that, we do a lot of infection prevention and control. I think half of our practices probably are in Ontario, and starting in 2017, 2018, 2019, infection prevention control has been just a huge issue in dentistry and the dental profession. And so making sure that everybody understands universal precautions, making sure that everybody knows the ins and outs of reprocessing instruments, of PPE, all the things today that are really top of mind. We fortunately, because of previous crises here in Ontario, we were well prepared. We had the exact right expertise, and again, we were lucky. And I think Graham said in one of our webinars, it's better to be lucky than good. And in this case, we were lucky that the previous trials and tribulations we've been through had sort of prepared us to deal with a pandemic. So infection prevention control, we do audits. Especially Elaine and Jamie, but other people on our team as well are on the road visiting our practices and making sure that we don't just provide them with an infection prevention control binder, but that we go there and we explain what's in the binder, why it's in the binder. They do walkthroughs of practices, and like only somebody who's worked in dentistry for decades can really explain the ins and outs to our staff and our clinicians, and they're well respected because they know their stuff. They have to earn their respect. Dentists are, and the dental profession is extremely demanding, which is good. And our staff and my team has risen to the task of earning their respect. So that's a big part of what we do. And then the analyst and the coordinator, Jeff and Tasia, they deal with hundreds of emails that you're talking about, whether it's sedation permits, facility permits, questions about certificates or designations or registrations that our professional staff has to have. They're on top of that. They're documenting it. They're keeping a record. They're reaching out to people proactively to make sure that nobody's license, whether it's personal or for their facility, ever expires. And that extends from sedation permits to radiation regulations, which are different in every province, unfortunately, and so it keeps us on our toes. And then there's a million things that happen in terms of risk. So any patient safety incident, adverse event, injury, negative treatment outcome, threatened lawsuit, refund, all of these kinds of things that are that not necessarily day to day, but that come up once a month or once a year in a dental practice. We have the benefit of 400 practices of experience dealing with that, and so we are able to use our experience to help people navigate all of those sort of tricky issues that arise, and make sure, hopefully that we resolve them to the mutual benefit of not only the clinician, but of the patient and the staff, and that if there's a lesson to be learned, we track incidents. So if there's an injury or there's a negative treatment outcome, we track it and we try to get to the root cause and find out what's the lesson to be learned, and make sure that the practice where it happened really internalizes that, but also to then take that, turn it into a case study, turn it into a course, and then make sure that the rest of our network benefits from that. So Some of the ways we do that is through, we have practice manager training, so onboarding, and then, we have annual or biannual conferences, depending on if conferences are canceled for public health related reasons. We have webinars that we provide. I facilitate an associate study club, a dentalcorp associate study club. So, and when I do that, I'm taking all of our knowledge from the network, I'm taking those cases that maybe went sideways, and then getting to the root cause, distilling them down to some way that I can hopefully use to improve the quality and the consistency of the rest of our network. And then we try to also always act as a connector, right? So we work very, very closely with our other cross-functional departments here. So human resources is a department that we work with all the time, because risk, and employment and occupational health and safety and staff, like they overlap and they dovetail. And so we're very integrated with our HR team, which is fantastic. We also obviously work with operations. I mean, I think compliance and risk are just really subsets of operations. Operations is the way that our practice is run. It's sort of the culture or the perspective that we try to provide to our operations team. So it's fantastic, honestly, working in the support center, because we have such great teams, whether it's IT, real estate, procurement, all amazing teams, amazing people. And we try to work with all of them to make sure that our practices are running safely, that their patients are getting the best care they can, and that there are as few incidents as possible. There will never be zero, otherwise we wouldn't have a job, but to try to learn from each one and then help the network learn from other people's mistakes. So my whole thing is, you learn from your mistakes, but it's so much better when you learn from others' mistakes. So, other people's mistakes. So, we have 1,000 dentists or something like that. I don't say we have them, but we are fortunate enough to support 1,000 dentists. That's the way I view it. And for each of those dentists that has something arise that's suboptimal, we try to learn from that and then benefit the other 999 dentists.
Yeah, I can interject there and say that the team that you've assembled and that we've had here, I feel very lucky that we've been able to tap into the expertise that you mentioned. I know our practice community feels the same way, and frankly, the amount of thought leadership we've been able to put out there has hopefully been an added resource to the broader industry at large. And I know I see the questions piling in from our participants, so thank you for that, folks. Please do have them coming in. We're going to do our best to speak to them, maybe not specifically, but from the various topics that we're going to address tonight. We are faced in a very dynamic time today. We've got a myriad of different provinces who are facing different circumstances as it relates to their own experience with COVID-19 and the pandemic. And what you have today in dentistry across Canada is a patchwork of regulatory requirements and a patchwork of the types of services that can be provided. I thought maybe, Julian, it'd be helpful if you spoke to what the national landscape looks like today and how that's differing across regions, just to give people an understanding. Often as a practitioner or as a member of a practice, you have an insular view of your practice specifically and province within which you operate more generally. But to understand the really dynamic landscape on a national level, I feel it could be interesting for some of our viewers. So why don't you comment on that for a little bit?
Yeah. I mean, that's sort of what I'm living and breathing right now. And unfortunately, I'm also sleeping it and drinking it and eating it. But it's unfortunately, there isn't one national landscape. What I would say is practices across Canada have either started to provide some elective care, or they are about to start providing elective care, or they expect to hear soon about when they can provide elective care. So we've been through over 2 months now of almost a national shutdown in dentistry, where 90 to 95% of practices have been either closed or operating at minimal levels, which is insane. Like, that's insane. I mean, I've been saying since I started working in this profession, supporting this profession, working in this industry, that dentistry is one of the most recession-proof professions there is, and I still think it's pretty recession-proof. But apparently, the pandemic is the black swan. So the last 2 months have been unprecedented, and we are fortunate to have professionals who've worked for 4+ decades in our network. And across the board, the one thing everybody has said is they've seen nothing like this. So we are now at the end of the first phase of the unknown, I guess is how I would describe it.
Very true.
Saskatchewan was the first province to get back to work in terms of elective care. It was followed by, Alberta, New Brunswick, BC. So these provinces are now open for elective care. The rest of the provinces are either providing no care, emergency care only, or emergency and urgent care. But I think across the board, we're expecting to get back to work. So that's where we are right now. And when it comes to the patchwork of regulation, we have in dentistry, and just talking about dental corp, obviously the majority of our professionals are either dentists or hygienists, and right there with the provinces and territories, we have over 20 regulators. That's not to mention public health, which has been very, very active. So we're talking over 30 regulatory authorities that we have to take into consideration. Ministry of Labor in each of the provinces is different. And so, we're already at 40, and that's before you get into dental assistants, denturists, dental technologists, dental therapists. We also employ physician anesthetists, of course. We have nurses in our clinics that provide sedation or anesthesia. So, dentistry is extremely regulated. So, and I think it's only going to become more regulated, at least over the short term. And so we have to not only be aware of those, as the Ministry of Labor, I think, is going to become more and more a part of our reality. So, staff coming back from having the last couple of months off, many of them are going to be very, very interested in the safety measures that we've put in place to ensure that our offices and clinics are safe places to be. And then, we also have to deal with the privacy commissioners, or the privacy officers in each of the provinces, which, as a healthcare company, we are expected to go above and beyond to protect personal health information, as well as all the, personal identifying information. Right now we are on the point of reopening. Basically, that's where we are. We've just reopened, or we're getting ready to reopen, and we're dealing with safety. Yeah.
Interject on that point, because a couple of questions came in, which I think are helpful for us to address. If you had to, and it is a complicated question, undoubtedly, if you had to distill the challenges of reopening into 2 to 3 key takeaways, what would you say they are?
The first one is attitude and culture, right? So infection prevention and control has always been part of dentistry. And, when we're getting back to work, we have to that has to really be top of mind. But on top of that, we need to understand that the patients that we service and our staff are going to be perceiving everything in a very different light, in that we're on stage. In a way, as dentists in the dental profession, that we need to rise to this challenge, which means regardless of if you're in the camp that thinks this is COVID-19 is overblown and it's no more than a flu, or if you're in the camp where you think, this is a serious risk to our lives, we need to really internalize the guidance of our colleges and the Ministry of Health when it comes to social distancing, when it comes to screening patients, making sure that sick people don't come to work. It's a culture change, it's an attitude change that takes infection prevention and control, that baseline, and rises up to the next level. So that's the first thing, is understanding that it's no less than a culture change when it comes to what you do at work. So that's step one. Step two is remembering that our staff are concerned, not our staff, but that the dental assistants and the hygienists and the practice managers and the receptionists and the treatment coordinators, the administrative support, the bookkeepers, many of them, they may live with someone who is immunocompromised, who is elderly, and who's at risk, and we need to reassure them that the safest, or one of the safest places they can be, is at work. And we need to do it quickly, and we only get one chance. And I'm not talking about just dentalcorp, but dentists in general. We get one chance. We have to remember that the Ministry of Labor and Public Health accept anonymous complaints, right? So we have to be ready to explain to anyone who's concerned or is worried about the current state of affairs why being in a dental office is relatively safe. And so that's step two, is implementing these changes, and then being ready to explain to our staff and our patients why those changes have made the dental office an acceptably safe or extremely safe place to be. And then, the third is that it's just remembering that we live in the time of a pandemic. This is not normal. And there is a lot of talk about the new normal. And I think, and I'm guilty of using that phrase excessively, but I don't think for the next year we're going to be in any kind of a normal. And so getting used to living outside your comfort zone, I mean, just as a human being, I think that is going to be an important learning lesson. We're going to have to get comfortable and accept the fact that there's uncertainty all around us. And so whether it's changes to the way we clinically practice, to the way we manage a practice, to the way we communicate with our patients, across the board, and Guy, as the president of the company, you have touch points with all of our practices, and it's really there's no part of dentistry, or even maybe our entire society, but there's no part of dentistry that's left untouched, and across the board we have to get used to doing things differently, and for things changing a lot faster than we're accustomed to.
Yeah, I mean, it's the change is a dynamic that I think a lot of people, both in our network and outside, are struggling to wrap their heads around. There's no shortage of talk around what are the things that practices need to do to be compliant, depending on which province they are. There's a lot of talk about, aerosols, a lot of discussions, and rules floating around, whether solidified or not, around closed operatories and air changes per hour, et cetera. We've had the opportunity, and you in particular have had the opportunity, to talk to a few individuals who brought a very specialized perspective on that. I know last week we had doctors Michael Glogauer and Howard Tenenbaum, who are very noted researchers in dentistry in general, and in particular have a very well-versed perspective infused by the research they've done on a lot of that discussion and dialogue around what do practices need to do to manage risk. I'm wondering if you could, for the purposes of those who didn't have a chance to tune into that webinar, or maybe who want to take away some key points, talk a little bit about, what are the things that the experts who are researching, the relative risk in a dental operatory, including as it relates to aerosol generating procedures, and the various approaches that are being thrown around, which there seems to be there is a bit of a lack of consensus. Much of the debate, grounded in where the science suggests we need to be. I'm wondering if you could share with those who are tuning in tonight a couple of key takeaways that Michael, doctors Glogauer and Tenenbaum were able to leave us. And as part of that, I know that you've had a couple of discussions with Dr. Katz, and I'll let you introduce his background. and just give us a bit of a preview over what, you know, your discussion with Dr. Katz indicated as it relates to that dynamic and topic, which is very much top of mind for a lot of practitioners, including those in particular in Ontario.
Yeah, I mean, there's a lot there because, you know, we can start with Doctors Glogauer and Tannenbaum, who I had the pleasure and fortune of speaking with last week. They're both periodontists. I think that's coincidental, but they're also both PhDs, and they're both the heads of hospital departments, the UHN and Mount Sinai. And, you know, they're scientists, I think, at the end of the day, is how they would describe themselves. You know, there's the physician scientist, and I think they're really the example of the dentist scientist. And, you know, they've scoured the research when it comes to the relative safety of dentistry, and specifically with regards to the safety of working around dental aerosols. And so, I mean, the takeaways, there were so many, and I think that the webinar is available on our dentalcorp home website. And if it's not available now, it will be soon, I believe. They're both just, you know, fountains of information and experience. So it's hard to set on, you know, 2 or 3 takeaways. But the first is, you know, they both, you know, established that the evidence that COVID-19 can spread through dental aerosols right now is absent. There isn't any. Neither of them said that, you know, the absence of evidence is not the evidence of absence. So that's important to remember as well, is that because we don't have any evidence doesn't mean it's not true. But, you know, what's important to remember is that there's a lot of unknowns. We still don't know, and they're 2 people who are not afraid to say I don't know. For the, you know, 60 years of collective schooling and 100 years of experience that they have, they're both not afraid to say I don't know. And I've had to get used to saying that a lot as well. I don't know is the answer to a lot of questions, because, you know, we're in unprecedented times dealing with a virus that virologists don't know a lot about. So, you know, we're learning a lot. And so I think the first takeaway is there's no evidence that the aerosols are causing disease. I'm hoping there never will be, but I can't discount that as a possibility. The second thing, takeaway would be there's still a lot of unknowns. And fortunately, there's a lot of research, and both of them echo the same ideas, that they've never seen the entire dental research apparatus work so quickly and with such precise focus as they have now. And so there are dozens, if not hundreds, of important studies going on across the world that will help us understand how dental aerosols actually behave in the real world environment, how infectious they are when it comes to diseases like SARS-CoV-2 or COVID-19. And that, you know, we are waking up to the need for evidence when it comes to risk and health and safety, you know, so that our regulators can make informed decisions, and so that dentists and you know, dental office operators can implement safety strategies that actually improve safety. So that would be the second takeaway. And the third takeaway would be that there are a whole bunch of things that we know can, if there's a risk, can cut down on the risk, right? And, you know, pre-procedural rinses, using high volume evacuation, which has been shown to, you know, reduce aerosols by 90 to 95 to 96%, depending on the study you look at, using dental dams to isolate the field where you're working, and, you know, and a number of other, you know, practical ways to minimize risk. As well as all the universal infection prevention control precautions that came into play after sort of the AIDS epidemic in the 80s. So, you know, I think what they both think the future is bright. I encourage people to actually watch the webinar if they haven't, that there are numbers of ways, you know, the sky is really the limit, depending on the level of investment you want to make. The sky is the limit, but there are a number of practical ways to reduce risk that every dentist can and should be implementing right now. And then, yeah, that, there's lots of research, and the evidence that's lacking now, we'll have soon. And I think we will be so much better for it as a profession.
Is there anything, this is a loaded question because I know there is, but for the viewers might be helpful. Is there anything that as an organization dentalcorp is doing to help facilitate that research?
Yeah, I mean, there are a number of ways we're trying. I mean, we've been in contact with multiple universities to try to advance research. We're working with some of the top experts in saliva and in infectious disease, not only in here, Ontario, with Kevin Katz, in terms of the work we're doing, but in the University of Saskatchewan. So, we are actively pursuing research opportunities, and we're involved in a couple of research projects, and open to working with any university that wants to work with us and our resources. So we've been very, very engaged with academia, with research dentists at many universities, and we have one project that is advancing. So that's exciting.
Yeah, one of the questions that on the topic of studies that I'm just seeing pop up in the feed here. There was one study in particular that I think a lot of individuals in the industry really clung on to, and it was this idea, I believe it was in the New York Times, it was publishing a study around the relative risk that healthcare practitioners and dentistry face as it relates to COVID-19. I know you and I have had some discussions around that. Why don't you talk a little bit about your perspective on that article and that study?
Yeah, I mean, so I saw that that was very early on in this whole crisis, where the New York Times published a graph, and it had a number of professions on a sort of a XY graph, and dentists and dental hygienists were at the very top of the graph in terms of risk to contracting COVID-19. And so, I think the variables that they took into account were essentially how far you were away from your clients or patients, and how often you were exposed potentially to pathways of transmission. And so dentists, obviously, because the work in hygienists in particular, the work that they do is up close and personal. And we're dealing in the oral cavity where there's saliva, and there's opportunities for infection. But what that graph didn't take into account were the safety measures that were put in place. That was completely absent from the risk analysis. And it was fine. It's useful for certain purposes, absolutely. Like, I think the people who are higher up on that graph just need to be more aware of the need to implement safety measures. But I think the last couple of months have showed us that there are a whole number of other professional groups that are probably far more at risk than dental professionals. Frankly, we have the luxury of screening our staff and screening our patients. We have the luxury of being well-versed in infection prevention and control, of having sterilizers and washers and all kinds of disinfectants, and there's any dozens, if not hundreds, of small things that dental offices do and can do to cut down that risk. So they just sort of measured the risk without any remediation efforts. My wife, Lara, works at a shelter, homeless shelter, and the people who work at that shelter are truly on the front lines. They're dealing with populations that are on average more complex, and have higher needs than our clients. And social distancing in that environment is extremely difficult. People say, stay at home if you're sick. That just doesn't happen. I mean, at a shelter, that is their home, right? So, that sector is very difficult. Same could be said for, people who work in prisons and detention centers, obviously people who work in, frontline healthcare and COVID-19 wards, people who work at supermarkets where they're certainly not pre-screening their staff. And if I have COVID-19 and I'm hungry and I've run out of groceries, despite, any sort of public health or safety measures, I may have to go shopping. So, there are just so many professions where they are also in close proximity with people who could transmit the disease and haven't taken all of those infection prevention control measures. My brother, for example, is the director of operations for an event company. His team does security for large stadiums and arenas. And so the people who work there are surrounded by thousands of clients that have not been screened. And an arena is literally filled with tens of thousands of people who, any one of whom could be a super spreader. So, just in my family, in my immediate family, my mom is a family physician and is doing COVID-19 tests in her office. So I'm like fourth place. I work in dentistry. I would say I'm in fourth place when it comes to risk. So, I mean, obviously I don't want to downplay the importance of taking COVID-19 very seriously and living, breathing, infection prevention control. But I think experience has told us that there are a lot of other sectors of the economy that are just as, if not more, at risk. I mean, working in a office environment, there was a recent study in South Korea of a call center where one person got COVID-19, and on a floor with about 250 employees, 97 got COVID-19 within a few days. I mean, so we're all in this together, I guess, is the takeaway. And dentists and hygienists and dental assistants have to be very careful. But by no means are they the only sector of this economy that are facing risk. And we also have to do our best.
Yeah, I mean, it's easy to somewhat forget the amount of precautions, safety protocols, and processes that dental practices were required to adhere to, before this pandemic hit, and how far those go to, mitigating the risk for staff, clinicians alike. One of the things that I'm noting in the myriad of questions that we're getting, there are a lot of questions, by hygienists in terms of how they protect themselves, a lot of questions around, use of dental assistants. And what's obvious is when you're part of a network and you've got the resources that we do, and you've got the opportunity to leverage expertise that you provide, we're able to navigate that. But for a lot of practitioners who are on their own, or a lot of hygienists who work at, outside of our network, what are the things that you could think about in terms of helping staff, hygienists, dental assistants alike, understand, the climate that we're in today, and helping them navigate, how they speak to them, helping them navigate how they get them comfortable around, doing their part as part of delivering dental care to their patients?
I mean, I think that is the question right now. So I'm just going to cheat and say that I would call the human resources department and say, let's have a conversation with this clinic, this office, this practice manager about our occupational health and safety program that we've put in place. So at a clinic that's not part of a group, I would say first you should have an occupational health and safety program in place. You should have a safety champion in your office. We've been implementing the idea of like a PPE champion in your office, and these should be the people, that work together with each of your staff members who can explain to them, what the risks are, how we're mitigating them, what the options are for accommodations to go above and beyond even the enhanced precautions that we put in place because of COVID-19 pandemic. To everyone, all of our dentists, internally, all of our clinicians, our hygienists, our dental assistants, and our staff managers, I would say, stay current. Read reliable sources, WHO, the Health Canada page, your local public health authority on COVID-19. Understand the prevalence locally in your neighborhood. So you can be worrying and then, you know, find out that within 200 miles, there's 0 confirmed cases. You know, or you could be overly comfortable and realize that there's a flare-up, a local outbreak, or a cluster. And so, you know, stay informed, stay current. Don't downplay anybody's concerns. People, their concerns are legitimate, and address their concerns by showing them how you've mitigated the risks. You know, there should be training on using personal protective equipment in every practice. There should be infection prevention and control training at every practice. And there should be someone who understands occupational health and safety, who is prepared to work with that staff member to gain, you know, their comfort. And, you know, call HR. Again, I'll go back to that because that's what I say a lot these days. And our, you know, HR business people are amazingly swoop in. And sometimes there are situations where someone lives with, you know, a boyfriend, a significant other, a spouse, or a parent who is at risk of having, you know, serious COVID-19 effects. And in those cases, you know, work with them as much as you possibly can to ensure that they're comfortable and minimize the risks, and understand that sometimes it's going to be up to your staff member whether they're comfortable with that risk, and you'll have to occasionally, you know, make accommodations or figure out what the best way for them to keep their loved one safe is.
Yeah, absolutely. You know, PPE you mentioned, certainly a hot topic, and one that, you know, again, for those tuning in, we've got a variety of participants in this webinar, both within the Dental Corp network and outside of it. And so we do want to be mindful with what questions that we're fielding and what answers that we're speaking to, so that we're speaking to a broad audience. You know, there are some queries that are very Dental Corp specific, and so we want to be respectful to those who are attending, who are not part of the network. And so on as it relates to PPE or any other questions that were specific, to Julian's point, there are a variety of resources that we provide to our practices, whether it's contacting our HR business partners, whether or not speaking to our practice managers, or frankly, your own department. There's a variety of channels and resources that we make available to our practices. And I would encourage those who've got queries to leverage those opportunities and those channels to deal with your more specific questions. I do want to be, again, respectful of those who are tuning in outside of our network. You know, PPE and access to PPE is you know, always a difficult you know, journey to navigate for practices, and we're not immune to that. You know, talk a little bit about what Dental Corp is doing, and talk a little bit about, you know, some of the risks that all practices are facing around sourcing PPE in this sort of environment that we find ourselves today.
Well, I mean, that's the $1 million question. PPE is sort of, you know, more precious than gold in a lot of ways right now. Or I guess, and I'm stealing this from my previous discussion with Dr. Kevin Cass, is you couldn't buy the PPE necessary to practice dentistry for all the gold in the world. It's just not there. So, I mean, the first thing is understand what the local regulations are. Be very familiar with what's required by the College of Dentists or the College of Hygienists, and comply with that. If there's ambiguities, contact the college, and we'll do that sometimes, you know, centrally, or we have dentists who have particularly strong relationships with someone at the different provincial regulators, and they will contact the college and clarify what's required. You know, so, you know, one province might say N95s are required, but our FFR, you know, 2s or our KN95s acceptable. You may need to clarify that. And so, you know, here in Ontario, there's the Practice Advisory Department, which is composed of a number of fantastic dentists who can answer your questions. So A, know what the regulations are. B, clarify what you don't know by contacting your regulator. C, when it comes to procurement, realize that it's a minefield right now. It is. There are so many brokers and companies that have just newly come into existence or have no experience in the past as distributors and suppliers of medical devices, who are selling masks and respirators and gowns that they don't know the first thing about themselves. And so, just realize there's a lot of counterfeits, unfortunately. There's a lot of price gouging going on as well. And so that's something to keep in mind when you're figuring out how much PPE to buy. And then also just in terms of safety, getting appropriate fit testing done and finding fit testers that work. We've had, fit testers on, fortunately, we've had a lot of experience now. And so we've worked with a number of different fit testers from coast to coast to coast. And we know that some of them, are overly eager to pass everyone. And some of them will scare all of your dental professionals to the point where they never want to pick up a handpiece again. And so you've got to find people who are scientific, who are methodical, who are data driven and who will help your staff find the fit that works for them. So find the right fit tester if you can, if you have that luxury. We have a procurement department, fortunately, who they haven't slept, as far as I know, in the last 2 months. And they do a lot of due diligence to make sure that the product that we buy is authentic. And occasionally, like anyone else, we've bought product that needed to be returned, but they were quick to discover that, quick to deal with it, mitigate the risk. The dental associations do a good job of helping out. So, rely on them if you're not part of the network, or even if you are, and just have your eyes open because there's a lot of people out there who are more interested in making a buck than making your dental practice safe.
Talk to me a little bit about barrels of monkey.
Yeah, so N95s are very, very hard to come by these days. The last N95 I saw legitimately for sale was, the price of it was inflated by like 50 times what it normally is. So that's the landscape we live in. Fortunately, KN95s are a lot more readily available to dentists, and we've been able to supply our practices with KN95s, but their ear loop design is not always amenable to like a solid fit. And so, for anybody who's used a KN95 recently or tried to, you realize that often you have to get what they call an ear saver. These little plastic devices that sort of tighten the mask around you and make it more like the straps you would see in N95. Unfortunately, a lot of people are selling these little pieces of plastic for $5, and it's crazy, but that's the world we're living in. We had someone in our network recently find out that what works equally well, or I don't know, I'm dating myself a little bit here, but when I grew up, we had this toy called a barrel of monkeys. If you've seen Toy Story, they show up in Toy Story, the cartoon. But that barrel of monkeys is like a monkey that sort of has its arms like this. And from what I've heard, it works. And Dr. Craig Young, I think in Calgary most recently brought this to my attention. But apparently it works for most people as well as, if not better than, those $5 straps, and it's far cheaper. But I will say, if our procurement team is watching, we should go out and buy all the barrel of monkeys now, because there may be a run on supply.
I'm sure they're all over that now. What's very obvious from the questions I see pouring in is, a lot of concern around access to PPE, a lot of concern around, if I work in an office where, they either refuse, they can't, what are we doing? One of the things that I can say on behalf of Dental Corp is that, as it relates to the requirements from province to province, we're always going to make sure that we can do our best to give our practices the resources they need to be able to provide safe and effective and great treatment to their patients, while keeping, again, their practitioners and their support staff safe. As part of that, this is a challenge that the world at large is facing. Dentistry is not alone in dealing with the shortages of PPE. We are in a unique position as an organization that we're able to leverage resources that most independent practices can't, whether that's purely by virtue of our economies of scale, or by virtue of the fact that we've got some pretty extensive connections in in the broader global economy, including from supply chain perspective. But there is obviously a lot of concern, depending on which province you are, around, how do I deal with my specific requirements? How do I deal with this restriction on open operatories? How do I deal with this requirement for settling time? And how can I do, or what can I do to help mitigate that? That's certainly something that practitioners are facing in Saskatchewan. There's certainly a lot of talk, a lot of talk around where Ontario will land in that respect. If you can give me one or two key thoughts around, where people should expect that's going to land, and what they can do to help manage the, obviously the investment's going to require to deal with that, and manage, what they can do to get ahead of that.
Yeah, I mean, that's a tough question too. So I'll go back to what I say about, the talk I had with Dr. Globauer and Tannenbaum, and the research in terms of whether there's a risk from those aerosols is an open question. We don't know. Saskatchewan was the first province to open up for elective care, and they did so under the parameters that the operatories had to be enclosed, and there had to be an adequate aerosol settling time between procedures. And all of a sudden, dentists and people who support dentists became experts in air changes per hour and cubic feet per minute. And so I think there was a feeling that every province was going to have these wait periods between patients, and then it didn't turn out to be that way with the next several provinces that opened up for elective care. Now, when it comes to HVAC, in this case, essentially it's a stand-in for, for dilution of aerosols, right? That's really what it's doing, is it's taking all the aerosols that are in the air and trying to reduce them by 99%. And then when you get down to 1%, according to some tables that I've seen, then it's safe to re-enter that room and to disinfect it and then to set it up for the next patient. Ontario has not issued their back to work guidelines. Quebec has not issued their final back to work guidelines. But I expect that at least one of the provinces that has not yet opened will probably follow Saskatchewan and require aerosol settling time. So it's not even really the term is not really correct. We're not really expecting them to settle so much as dilute them with fresh air, or by filtering them out through like a HEPA filter, which is one measure that so far it seems like all of the provinces have accepted is an adequate way to cut down that waiting time. So you can go from 4 hours, which it was in Quebec, down to 20 minutes or less in some cases, depending on how fast you can turn over the air in an operatory. And again, I want to stress that the whole point of this is to reduce aerosols by 99%. But it's also important to remember that studies have shown that high volume evacuation reduce aerosols by 96%. And I'd rather prevent those aerosols from getting in the air in the first place than have to worry about catching them later and trying to filter them out of the air. But we'll see what happens in Ontario. Obviously, that's a huge portion of the dental community in Canada. And they've often been leaders in several components of regulation and safety, and we'll see which way they go. But I imagine there'll be some element of trying to control for aerosols.
Yeah, one of the themes of questions that we're receiving is, as a practitioner, and if I'm not part of a network like dentalcorp, what do I do as it relates to just dealing with the sheer investments that I need to make to comply with my regulatory body, and depending on where you are in the country, and depending on when it is, some of those investments may be significant. And the question always becomes, well, at what point do I start thinking about how I pass that along, or at least seek to try to recover some of it from my patients in the form of fees? From our perspective, dentistry as an industry in Canada has always followed for the most part a practice and a cadence around fees that vests a lot of trust in the provincial dental associations where applicable. And often those provincial dental associations will do their best on an annual basis to think about, what is the cost of delivering dental services today? What are the things that dental practices need to do to ensure that patients are safe and to ensure that those patients are receiving a great experience from their oral care providers? And, the question of fees will always be a question that an individual dentists within a practice, inside and outside of our network, will have to address on their own. They'll have to ensure that in an environment like today, or frankly any other environment, that there's transparency around those fees, that they're communicating to their patients around why the fees are what they are. Those patients understanding why in a lot of ways, those are to address the significant costs and investments and expenditures dental practices make to ensure that those patients are receiving a great experience. And so, what I would say to that on behalf of our organization is there's no right answer to it other than, one, having a degree of faith in the dental associations, in how they do their work around fee guides, and making sure that they're mindful around the growing costs of delivering dentistry services, which have experienced a growth in the short term today, more so than I think in the short term past. One is, again, being mindful and hoping that they do incorporate that into their process, and two, again, thinking about your own individual circumstances, being reflective over the circumstances that your patients will face, depending on the economy that is prevalent in your neck of the woods. And if you do choose to pass along some or a portion of those costs to those patients, just being communicative around why fees have gone up. Patients, I do think, certainly are looking for healthcare practitioners, regardless of which discipline, to be making investments in their safety. I think a lot of patients don't quite understand the significant investments dental practices have been making for years around their safety. Yeah. It's always important to be transparent with patients around the things that you do. It's important to be communicative with patients around all the things that we've always done as dental practices to ensure their safety. And if it comes down to passing along a fee, whether it's nominal or not, the best thing you can do is, again, be communicative. Patients, and one of the questions we received today was, what are patients' expectations? I think it's easy because in a lot of ways, we're all obviously patients. We're all obviously consumers in this environment. And we do have natural expectations around each of the avenues that we pursue, whether it's a grocery store, whether it's a restaurant, and whether it's dental practice, around what are the things that we expect them to do to keep us safe. And I think a dental practice is very uniquely positioned to talk to their patients around all the things that we've been doing for years. A dental practice in a lot of ways sets a very high standard for safety. You talked a little bit about 2017 in Ontario. There's been a lot of dental practices over the last several years who have made significant investments around infection prevention and control. And to your point around the relative safety or risk of dental practice, those infection prevention and control measures go a long way to mitigating that risk. And it's important for patients to understand those things. And so as you're thinking around setting your fees, as you're thinking around what do patients need to understand about what I'm doing as a practitioner or as a dental practice owner or as a staff member to keep them safe, here's what I tell them. Here's what I'm doing. Here's the things that we do, whether it's a virtual waiting room to make sure that we're not keeping as many people waiting for their appointments, whether it's being overly inclusive around the things that we do to prepare an operatory before they step into it, whether it's being, whether it's leveraging teledentistry to triage those appointments in the first place. There's no shortage of things that dental practices do already today to keep a safe environment for staff and patients alike. And if you get down the path of considering what fees you want to charge, or simply just managing the concerns that patients have, or managing the questions that they may ask you, be transparent. Talk to them around the things that we do to keep them safe. I think a lot of patients would be really impressed with what dental practices do inside of our network and outside of our network. And they were doing this well before this COVID-19 pandemic occurred.
Yeah, I mean, I would add to that, a couple of things. One is, I think either today or yesterday, the Canadian Dental Association was meeting with the Canadian Health and Life Insurance Association to discuss the question of fee guide, to explore whether it's appropriate to create a code nationally for the cost of PPE, like a sort of PPE envelope, essentially, that could be passed on to patients. And so the third-party payers and the National Association are extremely aware of the increased cost of dentistry right now, and they're working on it to make sure that the profession remains viable going into the future. And so I think part of the answer is, be patient. A. B is to remember that we have an obligation to obtain our patients' informed consent for everything that we do, right? And that includes the financial component, right? So to explain to patients what they're being charged for, and so that they're not surprised when they see their invoice. A patient should never be surprised when they see their invoice. Essentially, I think that that's something that everyone should hopefully not find controversial in the least. And so that includes the potentially adjunct costs that some people in the profession have been considering passing on to patients. I would highly recommend people think about the environment of dentistry right now, and patients are, many of them, going to be scared of coming back to dentists in the first place, and so hitting them with a fee that they're not necessarily expecting is not a great way to win over the hearts and minds of your patients. I'm not saying it's never appropriate, but what must happen is the patient must be explained, like you said, transparent communication, aligning patients' expectations, explaining the changes, demonstrating the patients. When the patients walk into your dental office, they're going to see that things have changed. And so, you need to build up trust with your clients, your patients. And part of that is being forthright and explaining that, maybe the margins in dentistry aren't as large as the patients thought. And you are really adding a bunch of elements to the services you provide for their safety. And then let them know that it's also about the safety of your staff. And, ideally, the CDA, the Canadian Dental Association, and CLIA, the Canadian Health Life Insurance Association, will come to an agreement soon, so that practices aren't upside down when they get back to work, because it really is. When you think about the per patient cost of heightened PPE, is actually quite extraordinary right now. And I do think that will eventually come down as supply and demand work its way out, and as some of the restrictions start to be eased. And I also think that the associations and the third-party payers will take measures to respond and adjust, as they have in the past.
Yeah, that's a great response. Thank you. And I do see a couple of questions around how dentalcorp as an organization is dealing with the variety of different factors at large. And what I can say is we're always working steadfast with our practices across the country to ensure that they're able to comply with and meet, if not exceed, the standards in their individual provinces, which is always the barometer that we make sure that they comply with, making sure that regardless of which province you find yourself in, our practices have the PPE requirements, the air quality controls, the engineering controls that their provincial regulators require, and we will continue to work with our practices to make sure that we get them up to that level based on province by province requirements. And again, recognizing that this remains a very fluid situation. A lot of regulatory bodies and various provincial associations have put out communications to practitioners saying, until the dust settles, until we've come out with our final plan, hold off on investments. Until the dust settles, until we've got a final plan, hold off on making massive engineering controls to your practice. It's important for us all to realize that this remains a dynamic situation. It remains a fluid environment, and as circumstances change, so too do practices need to adapt to what those requirements are. And as an organization, we are uniquely situated to work with our practices, again, on a province by province basis to make sure that they're complying with their regulatory requirements. But individual practices will certainly have to navigate that on their own. One of the things that I want to make sure that we touched on before we left was there are no shortage of troubling if not crazy, if not one-of-a-kind stories that you've personally seen in dentistry in your career there? I thought it might be, whether it's entertaining or at least, again, helpful for people to realize that as an industry, we were always faced on a daily basis with unique challenges, whether it's a global pandemic, or it's an irate patient, or it's an associate dentist or a practitioner who's done something that makes you scratch your heads. I always get the benefit of the stories that you come to me with. Wondering if you can just share a couple of lighthearted stories with the audience here around the things that you've seen and some of the crazy things that I'm sure many practitioners have seen in their lives as they've operated their own practices.
I mean, so working at the RCDSO, I started, and it was my first job, immigrating to Canada as an investigator in the Professional Conduct and Regulatory Affairs Department. And while I was there, I saw hundreds, if not 1,000 different complaints, and some of them were not exactly lighthearted, so I won't get into those. But some of them did make me laugh. One complaint I saw was a patient who got so upset with their dentist for collecting the copay, which
they're required to do.
Which you're required to do. Yeah. That the patient filed a complaint saying, my dentist demanded that I pay the copay, and then names 3 or 4 dentists that she had had before who did not require her to collect the copay. And it was one of these situations where, all the people that she thought she was singing the praises for, she had just filed inadvertently complaints against all the dentists she loved, while letting the college know that the one dentist that she didn't like was doing exactly what he should. So that was one of the funnier complaints that I got, because, at the end of the day, everybody was okay. It wasn't, nobody's health and safety was in the balance.
Except for the patient who was irate.
The patient, well, she had to pay that copay, so that was unfortunate for her. That made me laugh, and I've always remembered that, because it's just sort of totally backwards. Recently, one of our dentists, and this is something I think that's important as well, and so I'd like to leave people with a practical tip, and so that is this. Essentially, be prepared for the contact tracers. As we start to open up and as we see more patients, all of the provinces are ramping up the number of public health employees that are doing contact tracing. And contact tracing means when somebody tests positive, the public health agent will call them and say, I want to know what you've done for the last 3 or 4 days, or since you were symptomatic or infectious. So if that person says, and it's already happened to several of our practices, well, I went to the dentist 2 days ago, the contact tracer is going to call the practice, and they're going to ask a bunch of questions, basically saying, what safety measures did you have in place? What PPE were you wearing? What kind of social distancing were you enforcing? How frequently were you performing environmental cleaning? And so the first time this happened, one of our partners, who I love, just a fantastic guy, so slightly neurotic as well, picked up the phone and got nervous and just started saying all of the things that they had done. And he said, well, we call the patients before they come, and we tell them, we ask them, we screen them, we give them all these questions, and then we make sure they don't have a temperature, and we make sure that they're not in the high-risk area, and then we screen them when they get here, and we take the temperature, and all of our staff have to sign a daily consent form to make sure that they're, self-monitoring, and we have logs for environmental cleaning for the bathrooms, for the receptions, for the waiting room, for the clinical area. Everybody's taken 2.5-hour IPAC training in the last month. I wear an N95, and we're using high volume evacuation the entire time, and I isolate my teeth with an oral a dental dam. The patients are escorted immediately to the door. They're released. It went on and on about all the different things that they're doing. And the public health, the contact tracer was just like, enough. Okay, that's fine. I have to go. I have to call.
You're good.
Yeah. And he actually said, I'm really impressed with all of the safety measures you've put in place, and hung up the phone. And I think probably the dentist had a bit of a heart attack, but they never heard from public health again. The public health didn't say we have to contact your patients. Said, listen, tell any staff that were, within 2 meters of this patient to self-monitor. That was it, right? And that's really the goal for us.
Yeah.
But
It's,
you know,
it's,
it's
a
really
great
important
point.
for you to prepare for that. Yeah.
Yeah, it's a great point because again, it's what's easy to lose track of, are all the things that we do in a dental practice already around managing risk, or all the things that we should do, I should say, depending on what you do. The guidelines and requirements have always been pretty extensive and have done nothing but been enhanced during this environment. And doing those things go a long way to managing risk. Doing those things go a long way to doing our part to help manage and mitigate the risk of this global pandemic. And it's sometimes difficult to not lose sight of that. Again, you touched on it earlier. There are a lot of industries that have done nothing else but some stickers on the floor and some spray paint on the sidewalk around managing social distancing. Dental practices do a whole hell of a lot around managing risk to support public health authorities in their efforts to stem the tide of the infection. And I know some questions have been around, what's the cross section between dental regulatories and public health, and are we doing our part by meeting our regulatory standards? Yes, you absolutely are. As members of a college or an association, depending which province you are, you're required to follow their requirements, and sometimes those requirements fold into other regulatory agencies. But it's important to educate yourself on your province. It's important to educate yourself on what those requirements are in the jurisdiction that you find yourself in, and do your part, understanding and appreciating that you've already and have been for a while, hopefully, doing a lot to mitigate the risk. It's again easy to lose sight of that. But if you stick to the principles that you've always been subject to, and if you stick to the principles that have been modified and enhanced to a degree in light of the situation we find ourselves in, you can't ever eliminate risk, but you can do a lot of things to really minimize it and provide a safe environment for you and your staff, and provide a great experience for patients who, again, some of whom at the best of times are stressed about going to a dental practice. Being communicative with them around what you're doing to keep them safe, being transparent to them around what the environment's going to look like, and over communicating to them around that whole dynamic helps build that trust with the patient, helps build that relationship that you need with those who receive your healthcare services. And so there's a lot of things that you can do in that regard. And just as we look to closing this off, as we're well past our hour, I do want to say I know there's been a lot of queries that are very dental corp specific, and to Julian's point, we are fortunate to have an organization that has some significant resources to help our practices navigate those questions. And so for those who I wasn't able to directly respond to your query, please do speak to your practice manager, speak to the lead clinician within your practice. If not, you should be able to contact our regional human resources business partners to deal with your specific inquiry. If not, and sorry to volunteer, Julian's team is always available to deal with questions around risk and safety precautions, etc. But obviously, those are avenues that those in our network have. And for those who aren't part of our network, to Julian's point, again, please do reach out to your local colleges or associations. They do have resources available for you. Dental Corp itself has made available its own COVID-19 resource website for all in the industry. Go to dentalcorp.ca. The link should be there on the front page. Please do look at the resources that we've made available. Everything from opening guidelines to managing human resource issues to contemplating patient communication matters. We are doing our part as best that we can to try to share the expertise that we have with the industry at large, because again, we're all in this together, part of a network or not. These are struggles that we're all facing. No one's immune to it. And if we can do our part, we're more than happy to. And we'll continue to update that as provinces continue to evolve their own requirements. We will also be adding to our resources and augmenting them with those new requirements as it goes. We're not going to stop our webinar series regardless of where provinces stand. I know Julian's going to be front and center to that. Hopefully you found it easier to be on the receiving end of questions than on the dishing end. Although I think that's a tougher seat to be in. But personally, I've always found speaking to you with your unique vantage point and expertise incredibly insightful and selfishly, personally, really helpful to us as an organization. And I hope those who tuned in today found the same. Please do tune in. We've got a couple of other webinars on the go. and we will be scheduling those for sure in the near future as well. For those who didn't have their answers questioned, again, please do email through our contact website at www.dentalcorp.ca. And for those who are part of our network, if it's a very specific question to your own individual circumstances, please reach out to your practice manager or to a myriad of individuals at Dental Corp whose contact information is available, again, through the community website. Julian, thank you so much for sharing your thoughts. Again, I'm not sure when you slept last. I'm pretty sure it was in the month of March. But again, I know our practices and I know our organization is incredibly indebted to what you and the team have done. And we continue to hope to add value to the profession by sharing what we know and what we've seen. That's helpful for them to understand as again, as we all navigate this new environment, which is far from over and in a lot of ways a new reality for us. So again, thank you all for participating. Thank you, Julian, again. I hope everybody continues to stay safe and continues to stay sane.
Thank you. Thank you very much. That was a pleasure, Guy. It was a pleasure talking to you. And thank you, everybody who tuned in. I hope you found it informative. And we will get through this together and emerge stronger. But it'll be a bumpy road, and we'll make it through.
Absolutely. Good night, everybody.